And what we want to do is take you through the nuts and bolts of eligibility enrollment according to policy. We're going to bring in pieces from other policy and from state code just so that you have good reference to help you with your eligibility and enrollment process. We also have 2 sample enrollment processes that have been shared, and we've had permission to share those with you all. They're documents, PDF documents that we'll also send out over the listserv, but you can also access them through the webinar site. When you enrolled and you got the website to log on, you can also download the materials even after we have the webinar. So we have those available. We'll make sure that we send them all out through the listserv as well. Eligibility and enrollment is such a big topic, and as we were planning these webinars, we were trying to figure out when the best time to really touch base with the counties on eligibility and enrollment. And what we decided was the sooner the better, because counties do this process across, planning for it happens across time, and it begins and ends at different spots in the school year for different counties. So we wanted to get the information out. I'm going to ask the ladies here to interject any comments as we go through. But what we wanted to do was just kind of look at it very holistically to give each of you the best tools that you can have as you look at your individualized processes. So let's just talk about the 3 main facets and the key elements of eligibility and enrollment. The first is the countywide universal enrollment process. That's the overarching process. This is what we do, and there are so many little facets to it in policy. We just kind of wanted to talk about that. One key piece of enrollment is determining eligibility by age. And when you look in policy, it talks right off the bat about what does an eligible child mean for pre-K. And it talks about 4-year-olds by September 1st, when 3-year-olds are able to be in pre-K programs, and when it's acceptable for 5-year-olds to participate as well. The second part is the application process, because the application is what actually helps you determine who's eligible. And then what services within your universal pre-K program are each child eligible for. And then enrollment requirements. So once you have a completed application and you begin the enrollment process and you're going through placement, what do you have to have from families to initially enroll? And what do you have to do as a county collaborative team to meet enrollment requirements? So those are the 3 main areas that we're going to address today. What we will do at the end of this presentation is open the floor through chat for questions that you may have. And we'll ask those questions, or we'll read the questions aloud, and then we will we'll hopefully guide you in the right direction or be able to assist in answering those questions. Okay, so let's look at enrollment. You have to have a countywide universal enrollment process. This has to be established, and there are a few things that it must include. One is a universal application. This is one application that everyone uses. So when one particular program has a requirement that they really need included to gather information through the application, the team really needs to look at that, and they really need to be able to include that piece so that you collect the right information. But you also have to balance it and make it not a cumbersome process for families. So you have to get the most information in the smallest amount of space, and through the least amount of questions. That's a tough endeavor to do sometimes. Then the collection and review process of the application. There has to be a universal system for collection and review that includes all the partners and that everyone is looking at and trying to place families based on what families need and still meet the structure of the program too. Then the third part is selection criteria and placement. Has to be transparent. So families need to know, everyone at the table needs to know how you do this process, how you collect the applications, how you place the children to meet the needs of the families the best that you can, and get children into the services that they need. So let's talk about the application first. First thing is the birth certificate. There have been a lot of questions about the state birth certificate and why families have to have the state birth certificate in place. And on this, on here we have a direct link to West Virginia State Code that basically says every child entering the school system must have a copy of a state-issued birth certificate. You can click on the link for the state code, and it basically justifies what you have to do and why you have to have that for admission into public school. One thing that we're encouraging counties to be very cognizant of is that when families bring in this state-issued birth certificate, it's okay to make a copy of it. We don't want families to give you the actual birth certificate that was state-issued, but a copy of the state-issued birth certificate is adequate. In fact, I would encourage families to make several copies of their state-issued birth certificate and keep those because as they go through school, they'll have to provide them for other reasons. If they want to play sports, if they want to participate in other curricular activities, there will be other times in a child's life that they'll have to produce the state-issued birth certificate. And if they give up that original, then they have to submit for another one and pay the fee to get another one. So having a copy of the state-issued birth certificate is adequate for the records for entry into school. The reason, and there's a process in code that for families who cannot produce the certificate, but so they need to go through that process of submitting an affidavit explaining the inability to produce a certified birth certificate, but it's all laid out in the West Virginia Code, and you can click right on the link to this. It has a lot to do with ensuring that children, you know, that they're identified as children being in the right place, and that they haven't been kidnapped, or that they're where they should be according to their family and law. So it's actually a very good process that our legislation has adopted to ensure the safety of young children in West Virginia. So you have to have that. The next one is, in the application, you really need to have an indicator that asks the question of the need for child care from a family's perspective. And it's just, is your family in need of before and after school care? We know that oftentimes counties have, you know, child care partners on board, and that the child care partners are listed as one of the choices in rankings for families. But it's also important to know that children have, you know, do they have before and after care in some other way if it's not with a collaborative partner, to capture the information on, you know, how many instances are children in early care with someone other than maybe the classroom that they're enrolled in as well. Is there anything else that you ladies can think of, or that question for child care? Tracy had a comment to add about the need for child care, but she's struggling with her voice, so I'm going to ask her to try.
Oh, gosh. I hope everyone can hear me. I apologize. As being one of the program reviewers that looks at this section most often, one of the ways we see this question many times is just simply asking the family if they've been in child care before or currently. And sometimes we don't then see that question asked about a need, as if a family that was not being serviced in that setting before, to help determine whether the need now exists that maybe didn't exist in the past. So that's one of the reasons we just highlighted here today, encouraging everyone to look at how are you handling this question within your county team and application.
Okay, and I know that we already have a question about the birth certificate, and we'll come back to that question as soon as we kind of get through this, because I know there may be other questions about the birth certificate as well. So we're gonna table the question for just a few minutes until we get through the rest of the pieces. So, family characteristics. As a collaborative team, what you all need to determine are what family characteristics do you really need to know in order to place children in ways that provide them with services that they need. And one of these includes English as a second language. If a family has another language as their first language, that information is so important in order to provide the best services to that family and to solicit assistance in making sure that you have good communication with the family, and also to tap into other resources that families may have. In the school system, there are opportunities that each family could have if they have English as a second language, and so identifying that helps you determine next steps for those families who do have English as a second language. And we are seeing more and more of this. 10 years ago, this was very few, but today it's becoming more increased, and we work with Robert Crawford's office in Title III and English as a second language to make sure that we have supports in place for counties who do need to work, who do need to support families who have English as a second language. Another piece of necessary information for the application process is residency information. And when we talk about residency information, this is not just the address, your mailing address, or your physical address, but are there ticklers in your application that that solicit information for foster care and for homelessness as well? Are you looking at, looking at the definition of homelessness? Sometimes families don't even realize that they are homeless because they live somewhere and the housing is provided by a family member. A really good example of this, just personally, is my daughter in dealing with college and her life. She had some medical bills, and she went to the doctor's office and talked to them, and they said, well, you could apply for a program to help pay your co-pays, and she said, why? And they said, well, technically you're homeless. And she said, no, I'm not homeless. I live with my mom. Well, she's 21 years old. She didn't realize that she was technically, by definition, homeless because she was not sustaining herself. It was, families don't realize that they meet this. So gathering the right residency information will help you determine how you can best benefit families and in relation to the residency, and what resources you can tap into for that. And the last piece is income identification. The Head Start programs have to have income verification in order to enroll children in their program. In order to do that, basically what the the county collaborative team has to do is identify who potentially they need to collect income on. That doesn't mean that every family in the pre-K system has to provide income. What it means is that we have to figure out who are the most neediest and how can we prioritize the neediest families for the additional Head Start services that they really need. I have said for many years that Head Start has a unique opportunity to really not just serve under-income families, but to really serve the neediest of those families and prioritize the neediest families first. All children who want pre-K services in West Virginia can have those pre-K services, but the additional services are very, very important in identifying those neediest children. Tracy wanted to speak to this piece in particular. Was very passionate about it, and it was very clarifying for me.
As we even continue at the state level to have conversations, because I would say this is the one that we get most often in regards to what is the requirement, what isn't the requirement. And Janet, thank you for really begin that conversation. And really here, I think this is some of the heart and soul of the partnership and how critically important it is. And many times, you know, we at the state level, we aren't at the front line and we don't really know what happens, but sometimes it seems like across partners there is a challenge to say, well, we don't have to do this, but you do, so you just take care of that. And really to collaborate and partner at the very high level that we do, it requires an understanding of the needs and requirements of both systems. And I think we have that in the majority of pretty much the entire rest of the policy, but I think this is the one area we continue to struggle with. And so part of this is that many times families would go to their local Head Start program prior to pre-K, and they may come in to enroll, but they may not bring all the verification documents with them at that time. We all recognize these families many times need assistance in identifying what they need and gathering it up and providing that documentation. So that's always been a role of Head Start, to assist families through that process, and no Head Start program has an unwillingness to do that. However, through this partnership, I think what's so critically important is as we all, as county collaborative teams, are talking about this piece with families, that we don't say things that discourage families from providing that information. In fact, rather, we understand the importance of it, and we help encourage families to provide that information, and we ourselves become a vehicle for helping to make that happen and not accidentally become an obstacle to the process. And so that could be things like, you know, being truthful with families. If someone says, why do I have to do this, helping them understand that pre-K is funded through a variety of sources, both state and federal, and they include Title I, and TANF, and Head Start dollars. And by providing that information, it helps secure funding, and and not just simply giving quick answers of like, well, you don't have to, but it's a Head Start requirement. Sometimes there can be a stigma with being identified as low income, as we all know, and so that may discourage a family from doing that. So, and you never meant to do that at all. You were just trying to give a factual piece of information. So I really encourage every county team to talk about this issue and to look at ways that it's all in our best benefit for those children that are most at risk due to foster care, homelessness, and low-income situations to be identified, to maximize all the funding streams, and be sure they receive all the services that they are eligible to receive.
Additionally, when we're completing program reviews and we look at the fiscal section of, you know, the contributions to financially to pre-K, you have school aid funding that's generated and earmarked for pre-K. You have Head Start dollars, resources that are included fiscally, child care resources, special education. And what we see are those who reflect really what they're spending. It's above and beyond what any one of the entities can do alone. We know pre-K costs more to run, and that's why legislatively they set up this collaborative process. And so we can't minimize one over the other in contributions. Everyone's contributions really contribute to the high-quality programming, ultimately.
Yes, and one additional piece related to this is that in 2525, and I forget the exact section, it states that, particularly around this issue, Head Start is most often mentioned. So it states in Policy 2525 that if you partner with Head Start, all Head Start performance standards must be met. And one of those performance standards is income verification. And so, again, that's another reason why it's so critically important for the entire team to really embrace what is my role in assisting that performance standard is met, that the funding is secured, but most importantly, it really gets back to the intent of the standard, is identification of those children who are most at risk and could benefit from additional services. So we realize these are very tough conversations at the local level, but we hope as we continue to have them, you know, we all grow through this process and make it work best for families, and of course, in a way that we don't ultimately jeopardize any funding, because it is so expensive to put on these programs.
But in the application process, looking at income identification will help you really plan for where you need to do more intense follow-up, so that you are serving the neediest children and have the process of identifying the neediest children through this process. The application process should be designed to minimize the number of settings in which children receive education in early care. This is kind of a very big statement, because when you look at program design, you have to work with what you have. If you have a plethora of child care centers on board, you can really offer lots of choices for before and after care, and children stay in one place for services. Oftentimes on how you serve children, though, but the whole intent is that you, to the best of your ability, minimize the number of settings. When transitions have to occur throughout a day, which sometimes they are unavoidable, that is time that is not dedicated to educational time. It is transition time. And so we encourage you to think outside of the box when you're planning these processes, but you'll ultimately have to meet the needs of the family. So you just really have to look at that as a team and determine how can we do that and minimize to the best of our ability, and try to keep children where they need to be to get the services that they do need. The placement options, families should be allowed to have input as much as possible on where to enroll their child to meet their needs and to support consistency and continuity of the child. Again, you have to be able to set up a system that prioritizes those children, and still it's a very delicate dance in figuring out how to serve the needs of the children with what you have to work with. Lots of counties are doing a really amazing job at this, though. They've really figured out how to provide rankings so that parents can see their choices and really delineate who goes where and still meet those needs, and being able to articulate to families how this process occurs is probably the most vital piece of it. Once you've made a decision as a county collaborative team on how you will place children, it's imperative to make that transparent to families that are applying and to the public at large, because you're eliminating issues on the front end of of the application process. This is probably one of the biggest areas where we all get phone calls from families and parents out there who are upset maybe because they didn't get their first choice. They applied for one center, they didn't get it, then transportation becomes involved, or the fact that they won't have transportation could be a factor. And parents do get upset when they don't get their first choice. So having a transparent selection process available up front is so imperative. And if you don't have that at this point, you really need to focus on that so it alleviates some of the issues in the very beginning. Okay, enrollment requirements. There are three main things that really, as far as enrollment requirements, really have to fall into place. Once you have a copy of a state-issued birth certificate, then you really start to look at the health requirements. And I have those available, age-appropriate immunizations. We're going to talk about HealthCheck and the TB screening that has to be in place for any child transferring from out of state or enrolling for the first time from out of state. So what I'm going to do is minimize this part and pull up Becky's presentation, and I'm going to let Becky King take over and talk about the eligibility and enrollment requirements for immunization.
Good morning, everyone. I'm going to be like Tracy a little bit here. Let me get my voice back. I just want to say you guys do a fabulous job in dealing with all of these health requirements, which isn't always your forte and what you do, but you've been able to manage it for years, and thank you for all you do. At first, I just want to talk a little bit about the immunization requirements. And we're going to try to help clarify a few things, and I've also asked for an update in the form, and that's the link that's in the policy, minimum immunizations for pre-K, for pre-kindergarten program entry. When we look at the form, and I may have pulled the old form too, I think it should say child care as well. When we look at the form, you'll notice it has the minimum dosage that are required. And go ahead and move out. As you look at the bottom of the policy, it's going to say we can provisionally enroll children providing a plan, which is something fabulous that occurs. We don't always see that as we move into K through 12. But a plan occurs, and a lot of times that plan is going to be the dates of the next dose and that the parents arranged those physician or medical office visits to get their vaccination. And then it goes on to say, but may not enter West Virginia pre-K classrooms until they have received at least the first dose of the required vaccination. So we know no one can enter with no vaccinations, not even the homeless. We get a lot of those calls because people say, McKinney-Vento, we can't keep them out. We do have state superintendent interpretation, and we have worked with the United States Department of Education, and basically our state public health rule is going to trump, and it's the same with Head Start that we've learned. It's going to trump those, but what we do is we provide services, especially for compulsory, we provide services within 3 days, and of course with pre-K, you all are case managing and quickly trying to help them find their records. And every state does have an immunization registry, and those are nice places to go back and try to assist parents. We have our own state. The problem is it becomes cumbersome when providers, and West Virginia is at fault when providers do not utilize the immunization registry. Big piece that I want to clarify with you is provisional enrollment. Provisional enrollment means they are age appropriate with their vaccinations. So it doesn't mean they had 1 dose of hepatitis A when they were 2 years old and they're showing up to see you at age 4. So At age 4, they can walk right out and get that second dose of hepatitis A. So we cannot provisionally enroll someone because they had their first dose 2 or 3 years ago. According to the Centers for Disease Control Advisory Committee on Immunization Practices, they are able to go right ahead and receive that second dose. And for hepatitis A, as you know, you only need 2, so they're already up to date. I'm just going to use another example, hepatitis B. They've had 1 dose of hepatitis B. They show up at your door. That dose of hepatitis B was given 3 months ago. They can go right out and get their second dose. They need to wait 4 months in between that, or 4 weeks, sorry. 4 weeks, they can go get their second dose. We provisionally enroll at that time, and then they have 2 months to complete their hepatitis B. So are we going to say, oh my gosh, at exactly 8 weeks you're out of here? No, we're going to look at our plan and see when they have their next appointment. It should be around the 8-week mark or somewhere in that time. We know providers, we're medically underserved in West Virginia. We do have local health departments. So those are some things that we're going to help with, and maybe even in the future work throughout in future conferences and try to get that information education. I've asked the West Virginia Bureau for Public Health to go back, and on the new enter form for K through 12, they give you some time frames for provisional enrollment. We didn't do that. They tried to make things simple. We did not do that. So I've asked them to go back and look at that. And even at the bottom, if you read, students may be provisionally enrolled in pre-K with at least 1 dose of each required vaccine and allowed up to 8 months to obtain up-to-date status. We automatically think, wow, 1 dose, and I'll give you 8 months to complete. But technically, that only applies to the DTP. It does not apply to all the others. The DTP is a 4-dose series and would take up to 8 months. So we know you're not healthcare providers. You may not have access to that. So we're going to work through all of that. So don't worry about it. And this is our starting point to clarify. And always tap into your Head Start nurse, your county school nurse, and your local health department. And you know, here at the Department of Education, I'll be glad to help along with the immunization program at the West Virginia Bureau for Public Health. So call anytime, because when you get into catch-up schedules, it gets a little complicated. So you can see on the screen, it just says each dose thereafter must be administered according to the recommendations for the next dose. And then we just move on. If they are not following, and this is the one that grabs your heart, if they are not following the provisional plan. So let's go back to say hepatitis B, they're supposed to be receiving their second dose in 4 weeks. On the provisional plan, mom head down, you know, week 4 or 5, she's on her way to the doctor to bring you in proof. Well, you're looking at it, here we are at week 5 or 6, it never happened. They are not meeting state enrollment criteria. They are now considered a public health threat in the state of West Virginia. So at this point in time, we want you to work with the parent, work with the family, and help them. But they have to meet this requirement. We don't want you to immediately exit them. Give them a couple weeks. They're going to have to find child care. We suggest you send a certified letter. And sometimes up front, they just tell you we're not going to do it. If they tell you that, of course, you're not going to be able to assist them anyway and be able to help them through this. So, you know, at that point in time, you can immediately, I'd make sure they get child care and notify them properly. But, you know, there's not going to be a lot of case management and assistance if they're not wanting to complete. And then even if they have an IEP and they're in special programs, doesn't matter, they have to meet enrollment criteria for immunizations. So this is one of those sticklers that in the state of West Virginia, you have to be immunized and you have to be following your provisional plan to stay in the school system. And we do have frequently asked questions. We have Supreme Court cases, so we have a lot of precedents set in this state that says, yes, we do follow those laws. All right, the HealthCheck. The HealthCheck is what is better known as the EPSTT, Early Periodic Screening, Diagnosis, and Treatment. And we've moved to the EPSDT, and you know, Head Start's had this as a standard for years, and the whole concept behind it is getting that child to their medical home, and really the dental home's part of that. There's an oral screening where the provider should be, medical provider should be moving them to that. In West Virginia, we know we have those issues where you're not getting the data on the form, you're not getting it back. Can we always say that it wasn't done? No, we can't. Sometimes they do progress notes and they don't share it with the school. So between, we have now state agencies, the Office of Maternal, Child, and Family Health HealthCheck program is working with payers. They also are working with the community. We have, I believe, Community Voices has taken on a grant to start working on developmental screening with medical providers. So we're working towards that. CHIP has been doing audits. Medicaid may move towards that and trying to make sure that documentation exists. And even in the HealthCheck manual, you will be thrilled in the revisions. There's a piece that says, please document the objective screenings so schools can enter children, so we have the data. So we're working towards that. If it's not there, I do suggest that you even use a HIPAA-FERPA consent so that you can talk directly with the provider to try to get the information. And as we just said, you're trying to find the needs of the family and the child. And if we're not working with their medical home who knows their family history, who should know their sick history, how, you know, all the illnesses they've had, even ear infections and all that, so it may help us out as we're trying to help the family and many other things. So just think about that as you're working with the medical provider. If they don't show up with a health check, are they a public health threat? No. We know in the end, once they're in our system, we know Head Start has regulations, and they're going to have some proof within 45 days of that enrollment. But we know most people start in the spring trying to get that proof. So please don't exit a child from your program because they didn't show up with a health check. Continue to work with the parents, and we know all of your teachers, your aides, and we even say all the way down to the custodian in the school, they're going to identify a deficit, and Head Start's going to work on the documentation they need, and they're probably going to work on it the first day and start moving, and we even see that done on some of the home visits. And don't forget about all those partners out there who may have already done some home visits and have documentation. And hopefully in the future we'll kind of help define some more of that through some more or less screening guidelines to assist. Here's just defining the health check. What is it? The health check is a comprehensive physical. It goes above and beyond our routine screening. It's a head to toe, but it does include vision, hearing, developmental, and the developmental piece includes the speech and language and the oral health. And we know schools have been screening for years. This moves it all back to a research-based, and it's called Bright Futures, the American Academy of Pediatrics. They should be using recommended research-based tools, and these are screenings. They are not assessments. They're screenings, and they're age-appropriate research-based screenings when we talk about that. We'll, as you all know, we've done a lot around this, but this is based on research when you look at it, and that's kind of why you see even speech and language inside of developmental. Research doesn't have any tools or prove any tools to be recommended, and it's all part of the developmental. So just keep thinking about that research-based practice. And also, we can't diagnose and treat, and you all have probably been put in the middle of a lot of that as you're trying to assist. And then if it's not diagnosed, the insurance payers won't pay for it, and we kind of see that with autism at times. If they're not diagnosing it in the medical home, it's not going to be paid for. All right, and finally, here is the TB requirements. We started thinking about the things that are required and thought, whoa, this is something that we kind of all know about, but we've never really put it in policy. So this was a great thing when the revision committee wanted to add the TB requirements. Just know when we look at that, TB testing is not for all new enrollments in the state of West Virginia. As you see in 5.6, it's for students transferring from out-of-state schools or enrolling for the first time from an out-of-state school. So if a pre-K student or parent shows up at enrollment and says, you know, we're moving to West Virginia, we're from Ohio, or we just moved into the state. That's kind of your red flag. They are enrolling for the first time from out of state. In West Virginia, we are a very low incident state. Probably been about 5 or 6 years ago now, we've removed the requirement for teachers and school personnel to have an annual TB test because we are low incident. We were spending more money on testing people than we were on treating TB in the state. So that has been removed. But your local health department should have certain days they do TB testing. And we're really moving into even blood work. But out of state is the only thing you're looking at when we talk about that. And there is a little bit of a 4-month rule. If they've been in the state of West Virginia for 4 months, we're not going to test them. They're already a resident. They should have already showed signs and symptoms. If you're unsure, again, work with your local health department. This is a public health rule. Now, the one thing we did leave with personnel, and you'll see here, 561, staff, volunteers, and student teachers, they are going to have a TB test. And that just assures everyone that they do not have active TB, and if they had latent TB, they've had TB in the past, that it's not active again. And the local health department, of course, will work with you to make sure that this happens. And this has to be completed before a student from out of state or a new employee can actually show up at the school and start working. At one point in time years ago, as long as you had your TB test, you could show up even if it wasn't red. But what we found out, we did have a couple of active cases. We ended up having to test classrooms and schools. So they have to prove and do that 48 hours or 48 to 72 hours, have to have their TB test read and prove that it was non-reactive and they do not have active TB, and they're welcome right into the classroom. Again, work with your Head Start nurse and your school nurse and local health department. All right, here's my contact information. If you have any questions, you're welcome to send me an email or let me know. And with Head Start, Tracy and I pair up because of federal regulations. It gets a little complicated, and we try to review it and make sure we give you the correct answer when it comes to some of those health requirements for Head Start, health and safety. Thank you.
Okay, so the last part that we're going to talk about before we review any questions is looking at, oops, moved it too fast, is looking at enrollment completion. So when is a child technically enrolled? You've done the application, your team has done the selection criteria, it's available to families, everyone knows how you go through the process. You are in process of obtaining all the health requirements, and then so what next? And enrollment completion actually happens with WEVIS. Each child must be entered into WVEIS, not technically supposed to call it WEVIS. They don't like that downstairs. But you have to enter the children into WVEIS to complete the enrollment process. So if every preschool child has to be entered into WEVIS, we're going to pose 2 questions to you. As a county collaborative team, think about the process that you have in your county. What is the process for entering children into the WVEIS system? And who's responsible for entering children into WVEIS? And what information, I'm going to extend it to one more question, what information are you entering into WVEIS? This is a pretty hot topic right now, as many of you have completed a survey on how this is actually occurring at the present time. There's been lots of questions within counties with attendance directors, with your health nurses, with your school secretaries, with your county collaborative teams on who's entering the information, what's being entered, and and how often even. So what we're saying from the state perspective is the process is going to be different, as with many of the facets of pre-K. It's going to be different from county to county, and what works for one county may not work for another. It just depends on the complexion of your collaboration. But those are the questions that I think you all need to take to your team and really have a system in place for entering this enrollment information. Who enters immunization? All this stuff is very affected throughout programming. Once children are entered into WVEIS, school aid funding is attached to those children who are entered. So they have to be entered in order to receive school aid funding. It also goes into requirements for attendance. And the process, it's directly related to your county process for attendance and how you support families in ensuring that children are, families that are adhering to your attendance policies and procedures as well. It also affects the early learning scale summary report with each of the reporting periods with the family reports. The immunization information is entered into the ELS report, and teachers and families have an opportunity to discuss, the whole child, and that includes the healthy child and facets of that. So that's why we want to end this presentation piece of it with these questions. What is your process, and who's responsible for entering this information? So those are the things that we really, really want you to take back to your team and establish. And we want you to consider those pieces: attendance, immunizations, access to WVEIS, what's happening. And I know that as Monica is aggregating the summaries from her survey on who has access to WVEIS, they're really looking with the WVEIS office on providing access to collaborative partners to be able to get into WVEIS remotely. So if you're not on a school facility that uses internet through the school system, there are opportunities for other collaborative partners to access WVEIS and be able to enter this information as well. So that's what we really want you to do as we conclude this webinar. I know that we went through a lot of information very quickly. We are actually going to post this recorded webinar through the department's YouTube page, and we'll send the link out with the resources as well to you all. But we wanted to pull the questions next and answer those. So I'm going to go through, and the first question was actually in relation to the original birth certificate. It says, do we have to see the original birth certificate, or can we just accept a copy of it and never see the original? Well, I'll tell you, you never take an original, but I will read exactly what it says in code. And if you click on, in the PowerPoint presentation, there is a link to it. It says under 18-2-5C, under birth certificate required upon admission to public school, it says, no pupil shall be admitted for the first time to any public school in this state unless a person enrolling the pupil presents a copy of the pupil's original birth record certified by the state registrar or vital statistics confirming the pupil's identity, age, and state file number of the original birth certificate. So it has to have the actual seal, and someone needs to see it, and a copy of it can be retained. I would not keep the original, though.
Yeah, and it just goes back to the safety of children who are abducted and everything else. And if they're not able, a lot of times we do hear where counties have to get law enforcement involved because they start getting concerned that a parent can't produce the original to enroll the child. So kind of red flag.
The next question is, how could you determine the needy children if you do not receive income identification from everyone? Well, I think I really want to clarify the difference between income identification and income verification. Here, income identification can be a scale, an estimate that families are offering, more of a ballpark figure. I mean, I can't tell you exactly how much my family income was today, but I can tell you a generally around how much it is. And that would be income identification, so that it helps prioritize who you need to follow up with for income verification. So income identification is more ballpark. Income verification is actually figuring out the dollar amount for the purpose of services. And Tracy, do you want to?
I think that's a great explanation. Remember, the application process, much like that for foster care children or homelessness, it's really ensuring that the application process has triggers that allows us to begin, looking at all those applications and helping determine exactly what Janet said. Which families do we need to follow up with? And when I say we, whatever that county collaborative team process is going to be, to say, how can we ensure? Because, again, not only we recognize, and this is one of the complicated parts, pre-K, everyone that comes can be offered a spot, but Head Start programs also continue to need to have a waiting list. And really in West Virginia, that can become a waiting list for services. And so that's another important piece, that you may go beyond just the funded enrollment number for Head Start of verification. You may verify families beyond that magic number cutoff a little bit, just so as you establish your Head Start services waiting list, that you already have the pieces you need to enroll children if turnover would occur.
Okay. Next question is, how long do you allow them to stay in school past the due time of the final immunization? After what point do you allow them to come back without completed immunization? Becky's going to take this.
According to your plan that you've laid out, and that plan should be following whatever that ACIP, the CDC catch-up schedule. So make sure you work with, and that becomes a little bit difficult, work with the nurse and the local health department. But once you look at that plan, I would say, within a couple weeks, if they haven't done that, you need to be notifying them when the plan date's up. So however you want to try to, that's what becomes very difficult keeping up with multiple kids on provisional plans, but making a flag that today's when it's due, making sure you talk with the parent, making sure you send letters. So within 2 weeks, I would get a certified letter out and give them a final date. Within a couple of weeks, they're going to be exited from the program if they don't show proof. Now, they can't return until they get vaccinated. And you'll see in our state at like age 3, only 75% are fully vaccinated. When they get to age 5, we're at 98%. So it's these rules and the laws that we live by in the state of West Virginia that we really see. Schools are the ones, the school requirements, which boost the immunization. So they can't come back till they get vaccinated. Technically, provisional doesn't mean just 1 dose. It means it's age-appropriate doses. I hope that's clear. I think I've confused everyone in the room, but call me and I can help clarify that further.
Okay. A comment was that the code says copy. The question is still about, do we need to see an original birth certificate?
I think that when they're saying that, we know the original that was requested at birth may not exist, so you're going to vital statistics or the county, the county courthouse to get that, and that's where they're looking that it may not be the exact first one that you ever had, but it is a copy of the original with a raised stamp on it so that you know it's an official copy. And that's the intent of the law, and that's even what we go by with Policy 4110, which is our attendance policy. So that does sound confusing when you say it's a copy, but they're just meaning the original's probably gone and the parents lost it, especially with a lot of the children we deal with who are transient or possibly homeless, that we'll never see an original. It's going to be an official copy of the original, so the word official.
So basically, if you have a copy of the state-issued birth certificate, a photocopy will pick up the seal. You will be able to see that it has an official seal on it. And it has,
that's what we're looking for, is that
I don't know.
it has to be the stamp. You'll see the stamp. It can't be a copy of the original. It has to be officially stamped and sealed either at Vital Statistics or your county courthouse. And we're finding that the cost is significant. It's cheaper at the county level.
I think it's $12 at the Vital.
And it's $12 at Vital Statistics. And now they're not just telling you a birth certificate. You have to request it after birth. So most parents, anyway, are getting that copy. They're not getting that very initial birth certificate upon being born. You have to request it and fill out the paperwork and pay for it. I think the first one's free and the rest are technically copied official certificates, and they charge you the $12.
It has to be from the state register or Vital Statistics, though. That birth certificate with the official raised stamp has to be from the state register or Vital Statistics. I know that this seems confusing, the language, and we will provide very clear clarification with this when we send out this PowerPoint, because in code it says a copy of the pupil's original birth certificate. So I think that that's confusing language. So just to make sure that we are all on the same page, we will have some written clarification that goes out with this to assist.
And the seal just kind of lets you know again that it is a copy of the original, and someone didn't try to alter and then run copies, and you would never know. And that just kind of helps expel any concerns, again, with abduction or anything like that.
Another question is, if a child is ranked very low on income and the parents want services in an off-site collaborative site, not served by Head Start, for example, must that child be considered as Head Start and thus must receive Head Start services? I'm going to let Tracy talk about this one.
Well, you know, I think that, first of all, at the heart of this, I think if this occurred, I'm always most interested in a conversation with the family and finding out what it is that they so strongly object to receiving Head Start, and ensuring that they understand some of the additional services and how they may benefit their family, because sometimes I think families feel like they have a choice of convenience versus services. And so making sure that they're making informed choices is always very, very important. And I think just at the core of this, though, Head Start is a voluntary program. I mean, we don't go around and label kids and, you know, go around and pick them all up and say you must do this or you must do that. So at the heart, Head Start is a voluntary program just like pre-K. But again, I think it's our opportunity and just a real professional obligation to ensure, just like with IDEA and other things, that families are making informed choices and that they truly understand what they may be declining.
Another next question is, if children do not have their physicals within the 45-day deadline, then what?
Just continue to work with them. And from the public school pre-K piece, I would say notify the teacher or whomever's managing the classroom that you did not receive the health check and you do not have screening. Some counties go ahead and screen them on top of that, but I do think we will identify in the classroom if they don't have it. So don't panic, but you are going to, I'm going to let Tracy answer that, but continue to work with the family. Try to get a HIPAA FERPA consent so you can just automatically follow up with their medical provider to try to get the health check. And that way, if the parent isn't able to facilitate that process, you are, or someone that's working with you is. But on the Head Start end, of course, at 45 days, they have federal regulations, and I'm going to turn that one over to Tracy.
Again, the intent of Head Start is this is an opportunity for at-risk populations to receive the services that are important, and certainly health is at the top of that list. So Head Start, again, looks for a supportive process, and so every individual Head Start program deals with that maybe a little differently. So again, this is where your partnership is vital. So please, these relationships to jointly operate programs, you know, it requires a lot of ongoing communication. We understand that, particularly around health. So we hope to see a lot of communication back and forth between county school nurses, county leadership, and Head Start leadership around that issue.
Okay, another question says, if our teachers have iPads purchased by our program, can they have access to WVEIS app to enter health information? And Becky's nodding yes.
Yes, you can, and just encourage you to go through the current process that's set up with either your county tech person or if you're working with the RESA WVIS person to get connected. So you would still be considered, if you're on an off-site or if you already have one in your internal, they have to go in and set some specific flags so that you can access it. So just let them know you want access to the WVIS health screen. If not, they'll get you set up with the WVIS number and figure out where you are and the type of access you'll need and what you'll need to see within the WVIS program.
We're going to field the questions that are on here now. We're already at 11:15, so we said that we'd be over at 11. So we're going to field the questions that are already on here. And then if you have other additional questions, please feel free to email them to me. I will get them where they need to go as well. But we do want to be respectful of your time. I know we had a really rocky start, but people have scheduled other things too. I know. So what we'll do is we'll ask these. There's 2 additional questions. We'll ask those, and please email them to me at jbock@access.k12.wv.us, and the information is on the information on the webinar as well. But one question is, it says that that classrooms should have a child's physical on file within 45 days. If a child never receives a physical, should the child ever be exited?
No. Continue to work with the family.
And then the next question is, we are having difficulty with the 45-day health check requirement, especially for those students who come in with IEPs. Should we just continue to document our efforts, or should we at some point not allow the child to return? So same question.
And just make sure you let the pre-K classroom teachers and school personnel know that you don't have vision, hearing, speech and language and developmental, so they can keep a close eye and refer. And then if you have Head Start regulations, you need to follow your regulations and work as quarterly with the family and the medical provider to get the documentation or obtain the screening to your program.
Okay, we've had lots of questions about that. I'm kind of going through them. So if we haven't answered a question that you have, please feel free to contact one of us. We will make sure that we get the appropriate answer for you, the correct answer. to those, especially around the 45 days and the immunizations and the birth certificate. We will make sure that we provide clarification. But the ultimate intent is to have children who are where they should be and be on the right track with health and assist families in doing that process. It's confusing, and we rely on one another. That's how it is for families sometimes. So we will continue to work on this piece of it, but we wanted to provide the basic information to you. We're going to go ahead and conclude for now, but again, please feel free to email with individual questions related to that. Thanks, and have a great day.